Today, we're diving into the Hennebert sign, a fascinating yet often perplexing clinical phenomenon. The Hennebert sign is a false positive response to pressure applied to the external auditory canal or middle ear, resulting in vertigo or nystagmus, but notably, without any actual middle ear disease. So, what's happening here? When a patient exhibits a positive Hennebert sign, it can point towards a few intriguing conditions. Let's explore these differential diagnoses. First up, superior semicircular canal dehiscence, or SSCD. This condition involves thinning or even a complete absence of the bone covering the superior semicircular canal. Patients might experience vertigo or oscillopsia, often triggered by loud sounds, known as the Tullio phenomenon, or by pressure changes, classic for the Hennebert sign. Next, perilymph fistula. This is an abnormal connection between the middle ear and the perilymphatic space. Symptoms typically include vertigo, hearing loss, and imbalance, often worsening with pressure changes or physical exertion. Meniere's disease also features here. It involves abnormal fluid dynamics within the inner ear, leading to episodic vertigo, fluctuating hearing loss, tinnitus, and a sense of fullness in the ear. Another important condition to consider is labyrinthine concussion. This results from trauma to the inner ear, often after a head injury, presenting with vertigo, imbalance, and sometimes hearing loss. Don't overlook vestibular migraine. Although there's no structural ear pathology, patients can experience vertigo triggered by pressure changes or other stimuli. Acoustic neuroma, or vestibular schwannoma, is a benign tumor on the vestibulocochlear nerve. While it commonly causes unilateral hearing loss, tinnitus, and imbalance, it can rarely present with pressure-induced symptoms. Lastly, cholesteatoma, an abnormal skin growth in the middle ear. If it erodes surrounding structures, it can lead to pressure-induced vertigo or other vestibular symptoms. Diagnosing the cause of a positive Hennebert sign requires a thorough approach. Audiometric testing, imaging like CT or MRI, and vestibular function tests are key tools to pinpoint the underlying issue and guide treatment. Understanding the nuances of these conditions helps us better evaluate and manage patients presenting with this intriguing sign.